We'll just wait 1 or 2 more minutes for a few other folks to be able to hop on. But thank you so much for joining us this afternoon. Hope it's warm wherever you are. It's a little rainy here in Portland.
Yeah, it is. Jordana, this is Rachel. Can you hear me okay?
Yep.
Okay.
I know you have to step out at some point, Rachel, so I got that note. Thanks.
Thank you. We are having a very busy smoothie demonstration right now going on in the school.
Ooh, sounds fun. We're sitting here with a smoothie bike.
Yeah, we have that too.
Oh, that's so cool. I want one. Yeah, I think they do. So we'll start in just 1 minute.
Okay.
Okay, we'll get started with just some introductions and attendance, and when other folks are able to hop on and join us, that would be great. Okay, so welcome to the March 2016 Learning Collaborative Call for Hallways to Health. This is our second go around. So thank you everyone for joining. I know there's a lot of really great programming happening right now. So thank you for taking a minute in your day to be here. So we'll start. We'll start with just taking attendance and getting introductions. So, I just want to start by kind of asking each site and each state to indicate if you are here or who from your team is here, because I know that some of you call in and may not be showing. So I see. Let's start with, thank you so much. Let's start with the California schools. So is anyone from Rice on?
Yes, it's Gabby.
Okay, great. Hi, Gabby. And
Hi.
is anyone from San Fernando? I know that they were not able to join for all of it. Okay. Is anyone on from Ray Hope Clinic?
Yes, it's Laura Garcia Chandler. Thank you. That was great timing. I just walked in.
Hi, Laura.
Hi.
Wonderful.
Yes, it Karen Manning.
Oh, great. Laura and Karen. Wonderful. And it's so great to put voices to the faces I've just been able to meet. So yeah, I'm really excited about that. Is anyone on from totally blanking here on all of my different sites? It's just so many. Is anyone on from Milwaukee? Rachel, you're on. Okay, great. And how about from Merlot?
Christina, I'm here.
Great. And sitting here with me is Brittany. Century. Is anyone on from Washington. Mandy, I think, was not able to join. She and Sarah Trivette are proudly representing us at the DC Leadership Conference, Leadership Fellows Conference. So it's really exciting that they're a part of that. Anyone from Lake Forest? Okay. How about Turner? Great. How about Whiteford? Okay. How about St. Francis? Okay, we've got some low attendance today. We'll have to make sure that we will record absolutely this presentation and be able to send it to all of the folks who are not able to join us today. How about anyone in Northwood? Okay, are you there? Okay. And how about JFK? Can everyone hear me?
Yes. Yeah. Yeah.
Okay. And anyone in Roosevelt? Okay, so I just want to reiterate that our monthly Learning Collaborative calls are a requirement for the grant to be present at. So thank you for those of you who are joining us today, and we'll be sure to send the recordings to the folks who are not being able to participate today. I have Lori Huffman sitting here with me from Oregon. Monica, I see that you are on the call. Hi, Monica. And I see that Sapna is on, and Molly is also representing us at the Leadership Fellows Conference. So she is not able to join either. Oh, there I go. Start. Okay, so I just wanted to take a moment to introduce. We have a brand new health educator who's representing us at Merlot Station High School. So without further ado, Christina, if you just want to say a few words about yourself and your work.
Yes.
Doing at Merlot.
So really, this is sort of my first week really diving into the H2H stuff. I met with Jordana and Lori yesterday about what we can kind of do to make the most out of these 8 to 10 hours a week I have. It sounds like we're going to be really focusing on some mindfulness efforts, and I guess a little about my background. I'm coming in as this is sort of a extra job for me on top of my regular position as a health educator in Multnomah County, which is right next to Merlot, where I'm doing a lot of just like kind of building materials and that sort of thing. So getting to actually focus on the wellness side instead of just the clinical side is really exciting for me. So I don't know if I've answered all your questions, Jordana, but I think that's a pretty good summary.
Awesome. We're excited to have you on board as part of the team, and as you'll get to be familiar with some of the other names in the conversation, it's a great opportunity introducing someone to talk about the value of cross-sharing between your sites, because you're often sitting in your own school-based health center kind of not aware of the other. So it's great to have someone to join us in the middle of the year. Yeah.
Yes.
So moving on with our agenda, we will be talking about introduction to policy change, and then we'll be discussing some of your successes, challenges, and opportunities kind of through that lens, and then I'll be at the end providing some project updates. Okay, so I just wanted to kick it off by showing you this this great video. It's called A Surprise Visit from the First Lady. And you can think about it with regard to your own work. Just moving into the correct screen to show it.
Okay.
And here we go.
Share.
So I'm just going to pause for one moment because I realize that we've been watching this video, and I don't think
There's no audio.
There's no audio. So you know what? What we'll do is we actually only have a minute of the video left, and then I'll just recap and give a summary. You can imagine what's happening. The First Lady is going to a variety of different schools that have gardens, and to a couple that grew a garden in their backyard and is using it as an opportunity for nutrition education and self-advocacy, etc. So we'll finish the video up for the last minute, and then, of course, when I send the recording around, I'll send you guys the links too. So apologies on my end, but I had to get your brains engaged creatively about thinking about what the audio might be. So I will absolutely send you the link. So I'll put it on just for the last minute, and you can see how the First Lady is interacting. Of course, it's a part of her Let's Move campaign with this couple. And the couple is talking about how they run workshops to help the community learn about gardening and really be invested in their own growing of food and how rich of an experience that is. They're talking about how they want to live a lifestyle that's more sustainable, so they wanted to teach their children in their community about growing and growing seasonally and composting and the benefits of all of those different components of gardening. And the First Lady is talking about where she hopes that there's just a future of community-based gardening and school-based gardening and the added value that that has for the community as a not only as a learning opportunity but as a nutritional opportunity. So I just wanted to take a moment to ask you. I know that over the course of my site visits, I've seen many in Oregon and California, and I wanted to also note that this is, these gardens are not only a wonderful thing for your students to be engaged in and learning about how to garden and the nutritional value of fresh fruits and vegetables and how to take care of a plant, but how to work as a group and a collaborative, but it also represents a policy change. The politicians at Laura's site.
Ray.
Yeah, at Ray. You guys have a wonderful space that's kind of a garden that's situated faces many of the classrooms, so the classrooms have specific access. And at Rice, I know that you guys have designated a space that will be for Huntington. There's an existing garden that will be a part of the programming as well. So it does represent a policy change to be able to access that space, to utilize it and get the permission from either the groundskeepers or a variety of other stakeholders. And I know that you've enlisted a lot of support through your school administration, through teachers, through parents, volunteers, to be able to keep those gardens up and to run really great programs for your students. So this is a really great example of system change, and when you're able to watch the video and hear what the First Lady has to say, you can get the whole picture of where the garden fits with creating healthy eating, active living, and really really healthy social emotional kids who are able to grow things and take the food home. We heard a lot of anecdotes about that. And it's an opportunity for both building personal skills and self-efficacy. Laura, you also talked about it being an opportunity to redirect students with social anxiety or reduce bullying during recess or after school, as well as some of you were talking about how you're utilizing the gardens for opportunities for mentorship from older students to younger students. So I'll be really excited to hear as the spring comes how those gardens are utilized and expanded and where that fits in. So moving forward, does anyone want to talk about their garden? And the benefits it's had for your students?
This is Gabby from California Rice School.
Great.
I just wanted to say I'm sort of new. Of course, I've taken Renee's position temporarily, and I did email one of our teachers who's in charge of the garden, so I was to hear back from her to see if we can move forward. We know that we have that space already because of the previous garden was taken away because of the new construction and remodeling. we're looking forward to contributing and having this new project back again. So just wanted to say that.
Awesome. Yeah, that's a major policy when to get that space reacquired and authorized for that use, and to already have a volunteer that's in charge of it as well is really wonderful. I know that there are sites that are not only working with gardens but are working with there are some curricula out there that are about gardens and about how the health education and nutrition components can be taught, and the vitamins can be taught through the gardening, and so we'll look to share some of those resources as well. Thanks for sharing, Laura.
Great. Thank you.
Sorry. So as we are thinking about, hi Pat, nice to have you on. As we're thinking about evaluating hallways to health and where we're trying to move, we're obviously trying to move in the direction, as we talked about in many of our site visits, and as we discussed as part of our first Learning Collaborative call back in February, that we're trying to work at the level of policy and system change. And I have been learning so much through these site visits, and I've really learned about the inroads you guys have made within the schools and within the communities, and an ability to cross-promote and collaborate and enhance programs and outreach through outreach and whatnot. And there are a lot of different components of your amazing work. And our goal is really to help you tell your full story about the impact of the work that you're having on students. So with that in mind, since we're asking you to think about what levels of policy you're changing and what systems you're able to change, we know that we wanted to, make sure that you kind of understood the various different steps of a policy development. So policy change can occur in a variety of ways, through institutionalizing relationships, which many of you have done, through institutionalizing services, through the provision of services, through changes in infrastructure, like acquiring space for school employees to have exercise within the school setting after school, or building a garden, as well as many other opportunities. Just as a reminder, some of the ways that we're going to be evaluating for policy change are about priority setting, at the systems level, what level of systems change you were trying to affect change in, and who you were able to engage, and what were the steps involved in the system change. And then talking about, was the system change adopted to address healthy eating, active living, or social emotional health? Who were the key stakeholders? What challenges were a part of the adoption and enactment process? How was a policy or system change implemented or enforced? And what's the impact? There's many examples of policy change that you guys have already done, and we're going to work through this framework to talk about the key steps that are involved in that, because it may not be something as a health educator when you're thinking about planning your smoothie day, or you're thinking about planning your anxiety classes or gender-based healing circles, or delivering restorative justice throughout the school, that you're really working on policy change. So we want to just empower you to own this language that you are agents of change, actually, within the school-based health centers and within the school community. So with that being said, I will turn it over to Kara Ann, who is going to explain to us various different components of the policy framework. And as you're listening, I want you to think about an example where you may have utilized one or more of these different components of the framework in a policy change you've already been, policy or system change you've already kind of been working on, one you've been able to achieve, or one you are working on achieving this year. So we'll have an opportunity to sort of share out about those different processes after Kara Ann presents on the framework.
Thank you, Jordana. This is Kara Ann McCrae, and
I'm very happy to be speaking with everybody, and I've spoken with a few of y'all on some of the calls, but not everybody, so it's nice to meet you. I'll start by saying that I'm going to give a broad overview of policy development, and I'm going to do it through walking through some steps of policy implementation. The slide deck at the end, as well as the reference to this framework and to the slide deck, which is a much lengthier manual that has a checklist underneath each of these boxes, and the checklist has even more information than what I will be presenting on these slides for you to consider. So you will have all the information and more that you could ever want when it comes to policy development. But I want us to start thinking about it, as Jordana said, because you're probably already well, I know you're already doing the work through the action plans that I've seen. And when we think about policy development, I know for myself as a research and evaluation person, my first thought when someone says policy development and policy change at any level, whether it be local, state, district, national, I think, well, I'm a research and evaluation person. That's not my job. I don't do policy change. And the second thing I think is anytime somebody asks me to develop change policy, that is a very daunting task. And how does one go about doing that? So it can be completely overwhelming. And I'm hoping that with this presentation, you'll see that, number one, you are the perfect agent for change, that it's not a daunting task, and that you really are already doing it. And we'll go through all of these boxes as we go on to the next slide. So through this presentation, as Jordana already said, hopefully as we walk through some of these steps, you'll see that the policy development at this level and giving you some tools, thinking about what you're already doing, thinking about the questions, will be able to give you some confidence that you're already doing this, or give you some confidence that you have more tools and a filter in which you can look at your work to see how maybe you can tweak what you're doing in such a way that it becomes more policy focused. Jordana, can you advance a slide, or is that up to me?
I got it.
Okay, thank you. And then the second goal with this presentation is going to be to talk about the implementation challenges that you may be addressing right now when you think about policy development. So on the next slide, we're going to talk about the key questions, and the key questions are pretty much outlined on the next two slides, which are just the 9 questions going back to that framework that was within the figure that I showed you. And as I said, we'll send that out, and we'll send out the manual that goes along with it. I chose, under each of the 9 key aspects of that framework, picked out some of the things that I think are very, very applicable given the action plans that I've seen so far. And I do want to give my mentor at school credit for sharing this particular framework with me, because I felt, after looking at a few other policy frameworks and working so closely with Jordana and seeing all the excellent work that everyone's doing through the Hallways to Health program, that this framework was more appropriate for the work that's happening at the ground level. So when we go to question 1 on the slide talking about policy development and alignment, let's think about policy development. As I said, the framework is really about implementation. So we're going to talk a lot about implementation, because if implementation is successful, then we know the policy was developed well. If the policy wasn't developed well, we're going to find that out during implementation. So if we think about implementing a program or implementing a process or implementing, which is what is happening through these action plans, I think it's going to be easier to think backwards about, oh, how was that policy developed, or how can we develop a better policy? So we'll be talking about it through that lens, even though we're still talking about policy development. We're just taking it from the successful implementation piece and thinking backwards to, if this is successful, the policy was developed well. So the first thing is that, I'm sorry?
Sorry, I just want to interject for 1 second and just kind of remind, because it's hard to think about policy development and alignment, and we're really thinking about small p. So we're thinking about, yes, what relationships have been institutionalized, what services have been either contracted or space designated, policies like that. Not necessarily huge things like changing the whole nutrition plan for the district. We're thinking about small p, but the steps are the same. So thank you. I just wanted to.
No, I think that's an excellent point, Jordan, and I think if we've got, please interject too, if as we talk about this, because you have been out to the sites, you already started with some really excellent examples of not only with the video, but excellent examples that you listed at the beginning of the talk about things that are happening on the ground with the school-based health centers that are part of this project that are those small p policy activities that are happening. So as we work through this, if anything does start to feel or sound overwhelming, please interject with an example that is a small p example. So when we talk about policy development, some of the things we want to think about is, how does this align? Is this policy aligning with other activities that are going on in your community? When you're making a change within your school, within your district, within your classroom, is this going to align with what's going on with other classrooms, with other schools? So for example, Jordana said something or mentioned before about somebody was talking about mindfulness and spaces where can be stress reduction and things like that. That is a small p, that's an infrastructure change. How is that going to align with other infrastructure changes? For example, is that going to be next to the basketball course or next to the basketball area or next to the gym where you're going to hear all of the activity that's happening there when it's supposed to be a quiet room? And sometimes that seems like such an obvious thing. However, it happens all the time during activities or changes that happen. So we want to think about if there are any barriers to the policy that you're wanting to change, how it aligns with other activities, and the governance. Are people sufficiently informed about this, i.e. the people who are using the gym? Do they know that during a particular time of day that the gym's going to be off limits? Because if it does happen, if that room does happen to bump up against the gym, it needs to be quiet. Are commitments and announcements being made so that people know that that room is now available to be used for that? And then is there appropriate record keeping and accountability so that these mechanisms that are established are actually being monitored? And I've seen that in the action plans that y'all have done to have accountability built in. So again, you're already doing and thinking through policy development. And I just want to remind you that that's an excellent part that we're seeing in your action plans. And it's happening, and we want to remind you that it's happening, but also give you more information so that you can keep thinking along the policy lines. So as we said, governance is part of that piece in question one, so we'll talk a little bit more about that. And I've had this happen with policy that I've worked on before, and this is extremely frustrating when you have a great idea and you've got all of your resources in place, or you think you do, and you have the political will, and you've got a great group of people, and you just can't wait to get this project started. And then all of a sudden you find out that the person who's involved or leading it may not have the authority to actually push it through. Or you haven't gotten buy-in from the person above the person who's that champion for this project or this idea. There may not be some agencies that have been appropriately engaged if you have to partner with other agencies, or you're talking to someone from that other agency and they are just as excited as you are, but their supervisor or their authoritative figure that is going to give approval for this hasn't been engaged. So we need to think about that horizontal relationship and that horizontal governance, but we also need to think about the governance of others and governance up, but also governance down, in the sense that are the people for whom these changes or these programs being made, do they have political will as well? Is there a level of accountability to be arranged for them to be a part of this project? So really thinking, not only taking that excitement and just making sure that we check that everybody's on board, everybody has the skills and resources and expertise at the right level to deliver whatever it is that you're planning to deliver at whatever level you're planning to deliver, and the authority to do so.
Yeah, and that's definitely, Karen, those governance, all of us in this room at Century, sitting together, looking at these.
Is everyone nodding their head? Yes, yes, yes.
Yeah. Well, we were really thinking about the school-wide needs assessment process that all the sites have, you know, judiciously involved in, and really tapping various different levels of governance to get approval, and then ultimately buy-in and investment and support to be able to conduct these needs assessment. Governance has been absolutely a huge thing.
And sometimes it ends up being 2 and 3 levels up, and sometimes it gets stalled by your partners 2 and 3 levels up. And sometimes it gets stalled, everybody's on board, and sometimes it gets stalled by the funding mechanism. You have one type of funding, your partner has another type of funding, and you find out that those funding mechanisms don't align. And next couple of slides as we move on to question 3, or the third triangle, which is risk management. So we always know our ideas are great, and we always know our ideas are fantastic, and we know they're going to work. So when we talk about risk management, what we really are talking about, I don't want that to come across as a negative way. What we're really talking about with risk management is planning for our lessons learned. Planning for those areas where, is there someone who can monitor? Is there someone who can look at the process by which this project, or when I say project, this policy change, but this project that has come out of a policy change is being implemented, and can we watch how it's being implemented in such a way that if something isn't learned, it can quickly become a piece of information that we can do whomever, and we'll talk about who that person or persons may be later on with the slides, but a way to build into the process, either through the policy or through the implementation of the policy, some way that we are always checking in and making sure that we have a chance to look at lessons learned along the way and not just at the very end. And if there's any way to have a contingency plan. Sometimes we don't think about that, but hey, if this doesn't work, we have these resources, we have this room, we have the buy-in of our school, our superintendent, our stakeholders. If this project doesn't work, do we have another project, a plan B, where we could use all of these resources in case this really innovative project doesn't work? And that's just an idea. It's not that you're setting yourself up for failure, but to be really thoughtful about it if you're going to be able to start something from the very beginning, i.e. policy development, and see it through.
Yeah, I would like oh, I'm sorry.
Go ahead.
I was just wondering if any of the California schools could mention risk management with regard to the cost meetings that you're a part of, or the community advisory meetings that you're a part of. You have them in the background. Actually, maybe Brittany, maybe you can talk about the role of the community advisory meetings that you have, and how that builds into the feedback loop for the risk management piece.
Yeah, definitely. So we here at Century have about 4 quarterly meetings each school year with community partners, district partners, local organizations, and ourselves. And what we do is we explain to them everything that's going on in the school-based health center, and they help us troubleshoot things, and they also take time to address some of the issues that they run up against in the school-based health center realm. So questions parents might have for them, or questions they just have for us to clarify certain where things are rapidly changing and evolving, and so keeping them in the loop on that is really helpful, and it's helped us really engage our community base better and communicate with our district level partners a lot. It also helps negotiate around really touchy situations. For instance, marketing was a really big issue for us because we just have those avenues to properly communicate to the parents, where it has a built-in mechanism to communicate with parents, and just using and collaborating inside of our advisory board group really helped clarify what
y'all are having
in order to properly communicate with parents. So that's one of the more efficient ways we've been able to use the advisory board. Awesome, thank you so much. Yeah, that's a great discussion of risk management. Thanks for jumping in there, Kara Ann. Do you want me to?
Absolutely, and I've definitely been on projects where we did not have that, and I'm sure other groups on the call have not had that feedback loop or that open communication. It's helpful to have the feedback and the opportunity to do that, and we'll talk about that later on in I believe slide 6 or 7. So we'll go on to the next slide, implementation, which we won't spend a whole lot of time on because implementation is what everybody does well and has a lot of experience in. But the one thing I did want to point out as you read through the slide is when we look at implementation, especially with something that's innovative, it's a good idea to look and see if there's lessons that can be learned from previous experience or a previous project that's similar. But I'd also like to encourage you to look at previous projects that are dissimilar, because sometimes you can look at a project that may have been put into place that wanted to do, I won't say the opposite, but maybe something that seems to be very different from what you're trying to do. And what were the successes and what were the challenges as of a lot of different reasons. There are more resources, but look at some of the previous projects, some of the ones that have failed or some of the ones that have been for projects that are different than the ones that you're doing now. There are still those lessons learned there. And that's not something we normally think about pulling from. So I'll leave you with that on that slide. Now, procurement and contracts are very important, and we don't think about that in policy development. Sometimes it's not even written into policy development or into the policies themselves where we're going to have those connections with our partner agencies or our partner stakeholder groups. Roles aren't defined clearly. Money and resources aren't allocated. Fiduciary responsibility isn't outlined clearly. So this is where it's really important to get the contract right and to be very clear about stakeholder or agency partnerships, not just, hey, I'm in, here's a letter of support, but really to understand what is my role, what's my responsibility from a contract management perspective, because that helps with communication. That helps with what we were talking about before, finding those lessons learned, those gaps, those why it isn't working. Maybe that relationship needs to be defined a little bit more. Maybe the resources aren't there. Maybe that's the wrong agency, wrong in the sense that, oh wait, that's not the skill set of that agency. Let's switch that around and give them the responsibility of X because that's their strength. So contract and procurement goes way beyond just saying, hey, you're going to work with is something that you need to think about strongly and try to weave into the process of policy when you're thinking about it. So we'll move on and we'll talk about how important stakeholder management is with the next slide.
Sure. Before I hop on to the next slide, I just want to think about one of the things that I've learned from the site visits are the opportunity to not only create like formal contracts, but even having job descriptions of school liaisons or teacher liaisons readily available and kind of updated that delineates specific, essentially contractual obligations, but it may not necessarily be a new between two entities and that has financial responsibilities on either end. So when we're thinking about small p policy, even in the descriptions of health educators and in the descriptions of these liaisons, that contracts can be delineated there as well.
So everybody knows how important our stakeholders are. I mean, we can't do any of the work we do. We can't do it at the Alliance. We can't do it at the state level. We can't do anything without our stakeholders. We know how important they are. And one of the things that I think we all know is that you can't engage stakeholders at the very end. But I would really encourage you to read this section in the longer manual because it gives some excellent questions and really broadens the way that we think about utilizing our stakeholders. So for example, just the question that's on the slide, will the information from the stakeholders be utilized and how? How will the information be used? Is it a one-way communication or a two-way communication? We're always questioning what the purpose of stakeholder engagement is. I would encourage you to go further and say, what's the purpose of the stakeholder involvement? Is it to get their perspective and advise? Is it or for you to consider, or is it truly for them to help develop the program? Is it for them to help implement the program, which goes back to the contracting? Is it for them to give you feedback on when the program isn't working or the process isn't working? Going back to the previous slide where we want to have that feedback loop and be able to identify challenges early on so that we can make tweaks to the policy if at all possible. And if there's a conflict with a stakeholder group, what happens then? It's really great if we can think about on the at the onset, what if this isn't working for a stakeholder group that's really, really important to engage with, and they just don't want to be a part of this process any longer. And we also have to be sensitive to the fact that while many stakeholders and many agencies have an overarching goal that agrees, everybody agrees we want to be healthier, everybody agrees that we want to increase wellness. Individually within the organizations, there may be some competing agendas. And it's not a bad thing to acknowledge that, nor is it a bad thing to talk about that. So this is a really effective chapter, and think broadly about stakeholder management and stakeholder involvement. So we can move on to, and of course, none of us have enough resources. So we work within the resources that we have, and that's where being efficient and not having duplication, as well as maximizing, is something that we all do. And I think from what I've seen, all of the folks working with Jordana are doing an excellent job and really, really have come up with some creative solutions. And I would just ask you to try again to take that to the next level and look more granularly at skills and experience and culture, systems and resources. And this is where you can tie these kinds of things back to your needs assessment. Where is the need? And can we leverage our resources to fill that gap or fill that need? And this is where you can also get very, very creative with your resources, because one of the things that I find is it happens not only in our own office, but I think it happens with stakeholders and agency groups as well. We all get pigeonholed and we all get stuck in our silos and our boxes. Oh, this is X stakeholder group, they do this. Well, usually people have a lot more that they do, or agencies or organizations have a lot more that they can do if you can have a conversation about all of the resources that they can bring to the table for this particular policy change or for this particular project. So I would encourage you to have that conversation, and a deep conversation about resources, and almost map it out like you did your needs assessment, and see where there is duplication and see where there are gaps. You might find that that stakeholder group that you didn't think could meet a specific gap might be able to fill a gap that nobody else can. So let's go on to the next. Go ahead.
Yeah, I think that last point was a really, really great one about school-based health centers in particular being able to provide for specific needs for student populations that other safety net providers can't necessarily provide for. And we've been talking about that in a variety of ways throughout our site visits, and how, you know, this conversation is right in my mind because I'm right here at Century, but we were talking about the opportunity of the nurse, Tara Roberts, I don't know if she's on or not, to be able to actually link kids with scholarship opportunities, which is outside of her clinical purview, but absolutely utilizing the skill set to be able to do that. So there's wonderful opportunities that you guys have, and really creative strategies that you've been thinking about. I know that in Milwaukee, I think Rachel and Christine have been talking about how they have worked with a local charter school who has a lot of mental health needs, and they no longer have a school-based health center. So to work with them to get a contract to get students bus over weekly to the school-based health center at Milwaukee so the students can receive services, mental health, and primary care. And that was obviously a creative use of resources to get that going. So yeah, I will move on to the next slide. But you guys have already, as Tara Ann mentioned, like these are new terms and new ways of thinking, but they're just framework for what you're already doing, and to really empower you to think about how you are really agents of change and how you really are changing systems to make school populations healthier.
And I think we'll end with that. I think we'll go back when we have our to the slide about the framework, talking about the goals and the questions when we're done, so that we can kind of have everybody call out and see and share how they have already been how they have already changed policy, how they have already been using these strategies. So when we think of communication, and this is the second to the last one if you're falling asleep, and when we think about communication, of course, we think about communication about the project, we think about communication about the implementation and what we're doing, we think about reporting, we think about filling out the forms that we need to for the funder or the grantee, but we also want to think about how we're going to communicate what is happening to the people that will be affected by the policy change. We want to think about any type of media management that might be happening if this is going out. If it's a policy that's going to be, or a project that's going to be controversial in any way, to be proactive about that, or are you going to be reactive about that? And that's okay too. But a lot of times we don't think about that. Is this going to be something where we're going to wait and see if somebody from the PTA has an issue with it because we don't think they will, and then we have a plan to address it if somebody brings it up? Or do we want to make this front and center on the agenda at the next PTA meeting and bring it up? There's pros and cons depending on the project or what the school's trying to do or what the district's trying to do as to which way you go with that. And that's where getting the stakeholder involvement or getting the stakeholder perspective beyond just having them engaged at a certain level might help inform. That's where going to your advisory group, that's where having both vertical and horizontal communication can really help. And also talking about any type of communication when you're rolling out a new project or a new policy is, do you want to communicate this ahead of time and or at the same time or after the fact? Does it need to be ready to go so that people walk in and utilize the new garden, or do you need to start communicating about it ahead of time so that you get the momentum that people can start helping to develop and build the garden? So thinking through that. And then we'll go on to the last slide, which of course is monitoring and review. And this is something we do and we think that we do at the end. But if we think back to slide number 2, we really want to monitor and review and think about what we want to collect both. And when I say data, it doesn't always have to be numbers. It can be the stories, it can be the feelings, it can be the reactions of how change is being accepted by people, how excited they are about it, and checking in with folks all along the way so that these lessons learned can be applied and that changes can be made along the way so that anything that you're doing can be refined. And you don't find out at the very end, and that's why we talk about feedback loops, you don't find out at the very end that you spent 6 months or a year or 2 years working on something that maybe wasn't as effective or didn't have the reach and impact that you wanted, and it could have had you tweak something early on. And this is especially important if you're doing something that has multiple stages to it, which is bullet point number 3, or the third bullet point, and the stages build on each other. So if you're going to if you have to implement step 1 and step 2 is dependent on that, it's even more important to make sure that you reach your goals, and if you don't, you know why at the end of step 1, so that you can set yourself up for success for step 2. And that is the end of talking about the framework. Again, you've got the reference. We'll send out this slide deck. We'll send out the lengthy manual, which is actually not bad to read because it's more of these into the form of questions that are very, very palatable and digestible. It also has some good stories, some good qualitative stories and examples about how these different pieces of that triangle have been used at a grassroots level, at a district level, at an individual classroom type level. So I think it's very helpful to see that we're talking about the small p and how really easy it is to be a change agent at the policy level.
Thanks, Karen. I was going to go through an example that sounds like some of your sites are utilizing and some aren't utilizing. And so we'll just visit that. And I'll read the example and we'll go back to the framework and we can, everyone can kind of share out where there's opportunity to tap into the framework when thinking about this. So one of the components that are obviously that is linked to clinic utilization and therefore healthier students, and I've heard that many of your sites are automatically enrolling students or including clinic enrollment packets in your school enrollment process. So I'm going to just scroll back to the framework, and if you guys can just call out like where where policy development, where risk management, where planning for implementation, where governance may come into play when talking about creating a policy for including clinic enrollment in the school registration package.
Mm-hmm.
Yeah, go ahead. So what might be a risk management piece that might be involved in creating that policy? What might be a governance piece that might be involved in creating that policy? Who would need to know, who would need to get on board with developing that type of policy to link the enrollment?
I would say most likely the front desk, the principal, and whoever your school liaison is if it's not the principal.
Okay. So utilizing the front desk staff is probably making those packets up, right? The admin staff, and getting a principal who to be on board with it. You're not going to be able to get that policy in place if the principal or school liaison isn't on board with it and doesn't see the value of it. Okay, what are some of the resources that you might need to leverage to be able to create that policy and to enforce it and to implement it?
Hi, this is Pat Setlow. I have not had any issue with doing that. It's just once it's part of the program, it continues to be part of the packet. We sometimes the consents and also the medical form, which all students or parents have to fill out for their student each year. The consent's actually good for the 4 years. So when it's part of the enrollment packet that gets sent out, we pretty much have the consent for every student in the school. The medical form also gives permission for discretionary drugs like Tylenol, Benadryl, etc. But sometimes their smallness also, depending on my assistant or myself or a volunteer student, will help them with putting the packets together. So that is just kind of manual to do this.
Right, so it may take a few hours of a day, and you may not be able to see as many patients that day, but overall it's going to increase your utilization rate. Yeah, great, thank you. All right, so I just want to, because I'm conscious of time and somehow we've already live it, I want to actually move to allowing you guys to share out what some successes and challenges in these variety of different areas for the policy evaluation framework have been. So you can think about your the changes that you have made in infrastructure, or you're aiming to make in infrastructure, about using classroom space or designating space for school employee wellness or workout, or creating a chill out space for kids who are anxious or angry, or increasing access. So talking about new renewing second chance breakfast options, or on school integration. So having your administrators bring students to the clinic. Are you doing annual outreach to the classrooms, to the health classes, to other teachers? Are you getting time in with the faculty? Are you presenting at staff meetings? Are you invited to be a part of those? Are you working with the folks at the attendance offices? Are you regularly interfacing with your staff and telling them about your services and providing services to them? Are you doing restorative justice? So I'd like some sites to share out about some successes and challenges that tie to one or more pieces of this policy framework.
Well, actually, Jordana, I'm going to be brave. I'm going to jump in. And actually, I wanted to share, we may be, I just picked up on a potential need and an opportunity to for social emotional learning with already vetted curriculum. And so, frankly, I'm in the process of researching that and connecting all the partners within the school staff and outside of the school staff to collaborate and implement that for the remainder of the school year, targeting a specific grade for our elementary school. So following all these, this outline here, this format here, where I'm basically going through all that right now in a very short period of time.
That's great, and that's Laura, correct?
Yes.
Great.
I thought you'd recognize my voice.
I did, but I just wanted to check. Anyone else want to share how they've done this in the past, or how they're struggling with a component of either the stakeholder engagement, the communication, the resources, the contracts, the procurement, or how they've successfully taken on one of these elements?
I can share. This is Brittany. So recently, after we get our RAP survey data, our school liaison and Dean of Students has said that they would dedicate student time for education around whatever behavioral health issues have popped up on the RAP survey. And then also fairly recently, through a lot of negotiation, we've been able to secure a time for staff to use part of their lunch break or all of their lunch break if they'd like to exercise during the school day, which has been something that we've been working on for a really long time, being a school year, and have been able to successfully nail down.
Yeah, and so what have been of the policy framework, like, when thinking about, for instance, securing the space force, what has been the piece of the policy framework that's been like the easiest, and what's been the most challenging?
The easiest has been having to say, oh yes, you should do this. So getting the feedback that this is something that you would like. And the most difficult part would be actually securing the room and the space and the time, just because there's a lot to negotiate when using a school space during the school day, because usually it's occupied with someone or something's happening. So school that's not being it being a wrestling gym, so a space that should actually be used for physical activity is a big one for us.
Yeah, so that sounds like a little bit of the stakeholder piece and a little bit of the contract and procurement piece and the policy aims and development. Awesome. Thank you so much for sharing. I want to move on. Does anyone else have anything that they want to share, either a challenge, a question, an opportunity?
This is Pat. I have just two things real quickly. One, we are having yoga, and we are having it during the school day. And the kind of yoga that we're having is, excuse me, called sunshine yoga or sitting yoga, so that particularly the staff that sits all the time can come and do that, but without having to change clothes and get mats out. And that's been very successful because we've had, many more people that are coming to it. The second thing is we proposed the Biggest Losers contest, and so far out of the 24 employees, we have 11 people signed up to do it, and they're going to do it, and they're each going to put in $5. They are going to do it. It's going to be judged on a % of the goal that they set, because we have, there's a wide discrepancy.
Oh, okay, so there's lots of different ways that this work connects, that thinking about policy framework and making the steps involved in policy change are connected to your work, and it's been really wonderful to get the opportunity to come to some of your sites, and I still have more to come, to be able to hear a little bit more of the full story, because I think it's really hard to sometimes, and the wealth of what you're doing, not only the part of Hallway's work, but as part of other grants and as part of your integration and collaboration within the schools. So I'm really excited where we can continue to move. And to some project-wide, our April Learning Collaborative call will also occur 3 to 4:30 Eastern Time. And we'll focus on the follow-up of this, of the evaluation of policy change. So how do you know that the steps that you have gone through for the framework here have been effective? Are you reaching the right number of people? And as Karen Ann mentioned, it's not always data, but sometimes it's stories. So we'll be talking about that. And I don't have the date written down, actually. I do have the date written down. I'm looking at a variety of other screens. So Brittany is going to pull that up. It's on a Thursday. So
Thursday 7th.
Okay, you got it. Thank you so much. Thursday, April 7th, so 3 to 4:30 p.m. Okay. And the next bullet point is about convention and the Hallways to Health Midpoint meeting. So as you know, the Alliance, School-Based Health Alliance, is hosting our annual convention from June 26th through 29th in Arlington, Virginia. And we'll be sending out a survey next week to get the names of folks who are interested in participating in that whole conference, which is a really wonderful learning opportunity. And we have the ability through the grant to be able to send folks not only to the required Hallways to Health meeting, but to send for the entire conference as well. So that'll be really exciting. And I just want to remind you that our midpoint meeting, our Hallways to Health midpoint meeting will occur on the Sunday, June 26th. It'll be an all-day long mandatory training for at least one person who's on the Hallways to Health grant. And of course, we'd like to be able to send others as well. So next week when we send that survey out, please indicate your interest, indicate your travel arrangements, your potential travel arrangements, and indicate the names of the folks who are not only coming to the Hallways meeting, but who are intending on coming to the entire conference. And we want to be able to provide that to as many of you as we can, because we feel like it's a really, really awesome opportunity. Obviously, sitting in a conference room at one school-based health center once a month, hearing from different sites is not necessarily the same type of learning that you can get in person. So that's why we are convening the Hallways sites in person. But it's also a really great opportunity to hear from clinicians in the field and leaders in the field, state leaders who are doing other programs, other research, other policy work, which is really relevant to the work that you're doing day in and day out in the clinics and in the schools. So look for that in your inbox. And at the culmination of that, some of you will also be eligible to participate in the American Public Health Association's motivational interviewing training. So that'll be an additional opportunity that we will be sending out along with the survey for interest and additionally, as I mentioned, I'm in the middle of site visits, as many of you know. The Maryland folks years are a little bit later, and the Georgia folks years are coming up next week. But I'll be sending around individual site visit follow-up, in addition to the template for our next quarterly report, which will be a little bit different. And many of you have indicated that you are really interested in hearing from other sites what best practices are and being able to cross-share resources. So whether it's infographics, health curriculum, policies, procedures, screening tools, etc. I will continue to facilitate these calls to allow you the opportunity to do that and to encourage you to do that, and would like to continue to encourage you to utilize Basecamp as a learning platform, as well as I will be connecting some of you directly with other sites based on some of the needs that have come up through the site visit. That was a lot of talking. So thank you all for listening. Does anyone have any questions about project updates? Sounds like a long lunch hour. Well, thank you everyone so much for participating in this call, and we'll be sending out follow-up information from site visits and a survey to see at convention. And if there's anything you have questions about the policy framework or any resources that you think about and connect to one of those elements, I encourage you to share them. I also encourage you to continue to be in touch with me if there's any technical assistance needs, if there's any stories you want to share, success stories and challenges, just anecdotes of connecting kids with service, or really great programs that you've been running in the schools. That's what I'm here for, and usually I sit at a desk in Washington, D.C., so the more I hear from you guys, and the better connected I feel to your work. So thank you guys so much. Have a wonderful afternoon and have a great weekend.
Thank you, Jordana.
Thanks.
Thank you from Kara Ann, too, for your patience and time.
Okay, bye.
Bye.